So good morning, everyone. I'm Lina Papartyte, project officer at EuroHealthNet, an organization that led the work on health promotion and disease prevention in Europe. So thank you very much for listening to what we have learned during those 3 years of the joint action. And today, as mentioned, I will be supported by Ingrid Stegemann, program manager at EuroHealthNet, who will offer us the concluding remarks. Yes. So what I would like to share with you today are 3 main things. So the main outputs and ready-to-use materials for your work in strengthening health promotion and disease prevention. Secondly, show the first-hand experiences from the sites who transferred, adapted, and implemented good practices, so the videos that Zoltan mentioned, and recommend most efficient ways you could instigate systemic changes towards establishing health-promoting communities. So CHRODIS Plus findings showed that there are many good practices across Europe in health promotion and disease prevention. However, they are not systemically applied. So working with 22 partners in 14 countries, we mainly focused on broader transformation of understanding of health promotion and disease prevention as one-off initiatives or information campaigns to really looking at it from a perspective of outside of health system and making health promotion embedded in the community life. So our main outputs, so working with the National Institute for Health and Welfare in Finland, we analyzed and assessed countries' health promotion and disease prevention strategies to really find ways where we could, the entry points, how could we make those changes. Then subsequently, we investigated how effective approaches in one country could be applied in another. And we transferred and implemented good practices targeting children, working population, and older adults. And finally, we identified success factors for intersectoral collaboration within and outside health system to strengthen health promotion activities. The work, which was led by National Institute of Public Health and Environment in the Netherlands and National Institute of Oncology in Hungary. So now quickly to introduce the 5 good practices that were transferred from one country to several locations in Europe. So for example, at the very top, you can see the Icelandic 6-month multimodal training program, which aims to promote physical activity levels of older people and their health-related behaviors. So it was transferred to Lithuania as well as to Spain. And another example, the toy box at the very bottom, the practice from Greece, was transferred to Malta, and it aims to promote healthy lifestyles in early childhood in order to prevent obesity through environmental changes and group interventions. But now you can learn more about those practices in the video that we would like to show you.
My name is Ingrid Stegemann. I hope that you see me. I'm seeing Lina as the main person. I don't know if I will conclude. I'm program manager at EuroHealthNet, and I will conclude this presentation. And I know we're eating up into break time, so I try to be quite quick. Can you hear me? About sign, okay. So I hope that you enjoyed seeing these examples of good practice from the field of health promotion and disease prevention that were transferred in the context of CHRODIS Plus. And just to mention again that these weren't the only interventions that we looked at. As Lina said, there are a very wide range of good practices out there, but they're being implemented quite sporadically, and investments in such initiatives remain stubbornly low. So it's important that we don't just want to see more one-off investments in such programs. We really want to see health systems that invest in them in a much more systematic way, as Tsaru Kowisko also said in her presentation. And we want to, so that the evidence of their effectiveness and also their cost effectiveness becomes more apparent, and they ultimately really start to transform the communities and the environments into ones that we live in, into ones that support health and well-being. The two tasks in CHRODIS Plus that we were involved in, that Lina outlined at the start of this presentation, came up with two different sets of findings or recommendations. And these are available in the final reports of these two strands, and the links to these are available in the chat box if you're interested. And these two sets of recommendations actually really overlapped quite a bit, because they were essentially about what can be done to successfully implement intersectoral approaches to promote health and strengthen health promotion and disease prevention in Europe. So we've combined these findings into a set of 7 key lessons learned, or recommendations. And in the interest of time, I'll go over these very, very quickly, but just to kind of bring this information together and some of these good practices that you've just saw about to draw some general conclusions. And the first recommendation is really about picking projects and programs that help to take forward existing policy priorities. Many countries have priorities that are linked to, for example, obesity, healthy aging, the need to reduce the escalating costs of health systems. And it's important to demonstrate how these good practices can help to meet these priorities, but also to help secure political support and the resource needed to also advocate more generally about how investing in health can contribute to a very wide range of other government and community objectives that are linked to well-being. The second recommendation is about the need to really build on existing motivation and resources and networks. It was evident from many of these transfer and implementation exercises that it was much easier to implement something new in a setting that already had what was often referred to in independent outcome reports of these good practices as a culture of health promotion, and to build on what is already there and start from scratch. Once it's possible to demonstrate how one initiative or one approach or process works and that it works, it's easier to encourage others to apply that approach in other areas too. The third recommendation is about the need to bring together an even wider range of different partners from different organizations, sectors, and levels to implement an initiative. And this is, of course, really core to health promotion, since many of the factors that shape health are beyond the control of those working in health. So it's important to bring in those organizations or actors that control these different levers. And a lot can be done also to encourage different actors within health systems to work together more effectively and efficiently. But this, of course, is much more easily said than done. So this brings me to the fourth finding or lesson learned about really the importance of appointing strong leaders and an effective steering committee to really manage the process and navigate the different interests in different partnerships and intersectoral processes. And this, of course, is much more easily done if there's a sound implementation framework that's applied. The fifth point, like the one that was developed by CHRODIS Plus. And this framework should really encourage partners to collectively formulate their common objectives that they all agree on and common indicators, and to identify possible obstacles and how they might be overcome, and to put the understandings in writing from the outset of the projects. For example, when transferring different initiatives, it's important that the partners decide whether it's a tight transfer, that things have to be really transferred as is, as was the case in the multimodal training initiative that you saw, that you learned about, or that it's a broader transfer and just elements of an initiative might be transferred. But it's important to know that and have agreement on that, those kind of things from the outset. It's also, of course, important to ensure that sufficient resources are allocated. And this can seem very self-evident, but it's so often underestimated, the resource needs of different initiatives. For example, the human resources that will be needed, and particularly also the resources needed for evaluation, which is so important. We found in CHRODIS that it was so important to really, in this transfer process, that it's so important to really allocate sufficient resources for exchanges between the owners of an initial of an initial project and the new implementers. And while this can be costly, the partners did invest in this, really considered the returns to this investment in terms of improvement, the outcomes, to be very substantial. So this leads me to the seventh and final point, that it's a finding on the value of building and engaging in communities of good practice around similar initiatives that are being implemented within and between countries. The interventions that were transferred and implemented in the context of CHRODIS that managed to maintain good contact between the owners and the implementers, for example, found that this really inspired and enhanced the motivation of all of those involved. And those that didn't do this really saw it as a missed opportunity. So there's so many opportunities nowadays to really keep exchanges going virtually through Facebook and other forms of social media. So really, we should take more advantage of this. So these are our findings that were identified and reinforced through the work of CHRODIS Plus, that can all help contribute to achieving a more systemic application of health promotion and disease prevention in Europe. We've unfortunately not had much time to discuss or to answer questions, but we luckily do have a round table after the break on this session, and the questions that were, some questions were posed in the question and answer box, and they're actually very good ones to take into that discussion. So I do hope that after all this listening, you will join us there, and we'll have a bit more time for a more active discussion on these themes that we've laid out this morning. So thank you very much for listening.